Hello, everybody, and welcome to another episode of Adoctorsjourney Podcast, navigating life and medicine with coaching and healthcare innovation. I am your host, Miguel Villagra. I'm a certified physician life coach, positive intelligence coach, and I'm the founder of Adoctorsjourney platform. Today, we have a special guest for today's episodes, and I'm very grateful of having Dr. Sean Yousefi. He's a PhD and expert in engineering, and he has an amazing company called Mesh AI. I'm very pleased and happy to have him here and share his journey. Sean, how are you doing today?
I'm doing great. Thanks for asking. My answer is typically, I hope to be happy and healthy. And this is one of those days where I can say I'm happy and healthy. Thank you for having me.
Fantastic. At this podcast, we try to bring physician and non-physician entrepreneurs that are part of the movement of healthcare innovation, and some of which are tackle some of the most important problems that affects physicians. And before we get into talk about a little bit about scheduling, I want to first spend a few minutes for you to share with me a little bit about your journey into entrepreneurship and see how that path has gone for you.
There are all kinds of entrepreneurs, and I'm not shy about sharing what type I am. So I'm an entrepreneur out of passion. It is a personal journey for me, and I've been very open about it. I have a health condition that has had me have DVTs, deep vein thrombosis, 3 times, and each in a different country. As an academic for the past 20 years, I've had the pleasure of working and traveling to 85 different countries. I've lived on different continents, and I've been a professor at multiple institutions. I had my first DVT in Canada, the second one in Switzerland, the third one in the US. So as a nosy patient who's been a professor of engineering for more than 20 years now, I had a personal encounter with the challenges of bad scheduling, in fact, manual scheduling. In my case, scheduling that was done on a spreadsheet and the error that led to fatigue that caused issues for me. So when I discovered that, every time I talk about it to this day, I get goosebumps that we're still doing a spreadsheet scheduling of probably the most important resource in healthcare today, which is people. And so when I learned that, it was very painful for me at a personal level. The more I learned about it, the more painful it got when I realized how big the problem is. So that's why we exist. And from my own perspective, I've been able to bring together a team of unbelievable scientists and engineers and physicians to build a platform we call Mesh AI that does the scheduling for healthcare today.
That sounds fantastic. Oftentimes, when we talk about scheduling, we just talk about how we can keep our schedule organized and things like that. But I truly believe that goes far and beyond. And one of the many issues that affects physicians and physician entrepreneurs and non-physician entrepreneurs as well is the phenomenon of burnout. And sometimes it's a multifactorial issue, but I want to hear your thoughts about how a consistent, transparent schedule can help physicians and physicians entrepreneurs, private practice owner. How can I tackle the burnout? What is your angle on that?
That's an excellent question. One that I get a lot and I really like because I've spent a lot of time on this. I can't call myself a researcher and an expert in this area, but I spent about 10 years living most of my life with physicians right now, among physicians, fellows, and residents, and people in healthcare. And I work with international expert speakers in the area of burnout or wellness in healthcare. And I can tell you this, one of the misconceptions a lot of times people have when they think of us as a scheduling platform in healthcare, we only do healthcare. We actually get demos canceled on a daily basis, people coming from outside healthcare, like education, manufacturing, other areas where time matters. And we do not support, we cancel every single one of those. We only support healthcare and very specific use cases in healthcare, very challenging scheduling. And the scheduling we do is only human blood and flesh scheduling. So meaning clinician scheduling. We don't do patient scheduling, which is also human, but much simpler problem and a completely different problem. We don't do a scheduling of equipment and facilities, rooms either, which is very important in surgery and some other areas such as radiology. So when you think about the clinician scheduling, there are 2 angles that support with reduction of burnout and improving wellness. One common issue, both in Canada and US, physicians have been doing more and more of admin work and less of time spent with their patients, what they signed up. Most physicians go into business because they like helping people. Money is great. There are a lot of good things about being a physician, but the majority of physicians I know, they go into the business because they love helping people. And the more admin time they do, the less time on something they love. And we know how that contributes to the drivers of burnout. The moral injury of healthcare and burnout, these are significantly studied by people at Stanford, Mayo Clinic, and there are books written on the topic, so I'm not going to get into them. But there's a direct correlation between the amount of time that a patient is taken away from bedside and put on tasks that really not qualified. And I say qualified because they're way overqualified for those jobs, such as administration, such as spending time on a spreadsheet at 10 o'clock at night, managing a call schedule. That's not something a physician should be doing today. So that's one. This is the time to spend with your patients. This is the time to spend on your health, with your family, with your loved ones, with your hobbies, yoga, whatever that matters to you, whatever floats your boat, to become a better version of yourself. So that's one. The second angle is that there's data on this very clear that shows physicians have been losing control. Over the past 70, 80 years, especially in the US, less ownership, less control when it comes to patient care. Nobody is more qualified to do patient care than physicians. And now we have MBAs, without any disrespect for MBAs and business owners and healthcare system owners. Corporate is running healthcare. And that's increasingly the case in the US, and it's becoming similar in many areas in Canada where we have universal healthcare systems. Well, this is how we give back. We want physicians to start getting a little bit of control back. The way it's done by owning your time. So having a say in what we call bi-directional collaborative scheduling, which is what Mesh AI does, and we're a category leader in that. We allow physicians to tell their managers, their healthcare systems, what they need to be the best versions of themselves, which leads to better patient outcomes, better patient satisfaction, and access to care, revenue, all the good things that we talk about in quintuple aim of care. They come through better taking care of physicians. So that's the second angle that is key for us.
That is fantastic. And I think that bringing a little bit of order into our chaotic environment in healthcare is very chaotic and even disorganized. There's a lack of integration among multiple stakeholders. So I really like that message that you have. Now, I do want to touch base on the future of technology. And one of the things that is revolutionizing the way we practice in medicine is artificial intelligence. So I want to hear your thoughts if you have implemented that into the workflow of your company. And also taking advantage of you being here with me today, I want to hear your thoughts about where do you see this technology coming in the future?
Absolutely. Great question. Again, as a professor of engineering, mostly doing signal processing algorithms, I used to do telecom, and then gradually people in signal processing and computational science, foundational stuff have gradually moved towards more lucrative areas of artificial intelligence, machine learning, and so on. As a disclaimer, I'm not an expert in those areas, but I've been doing more than 20 years of R&D in algorithms, and naturally I was brought into AI. So there's a huge debate today, and it's a valid debate, and it's a very important debate for the future of humanity. What is the definition of intelligence? What is the definition of AI and generalized AI? And what is the impact on humanity? What is the impact in healthcare? I'm going to give you my view. We have the Elon Musks of the world. We have Sam Altmans of the world. There seems to be a dichotomy. I sit somewhere in between. I completely see the challenges, but at the same time, I see opportunities. So my personal view and Mesh's personal perspective today is that healthcare is a human-centric business, and it will stay that way for a long time. We are not going to be able to replace physicians. But we can enable physicians with technology and tools such as AI to be the best versions of themselves and scale their operations. If a physician typically sees 20 patients a day, it's very easy to show that technology could allow them to see 60 patients a day. Less charting, more focusing on cases that matter, categorizing cases based on importance. And passing on cases to nurses or other professionals, other HCPs that maybe do not require the attention or work of a physician at a particular given time. Our view is that the AI of Mesh AI is augmented intelligence, not artificial intelligence. The way we think as Mesh AI is an augmentation, as an assistant to whoever does the scheduling. And sadly, in most use cases we support, there is a physician involved, sometimes multiple physicians, that has spent tremendous amount of time on spreadsheets and calendars and sometimes paper and pencil and whiteboards to do a scheduling of their colleagues. We think that is fundamentally wrong.
Fantastic. Yeah, no, I totally concur with you, Sean. And I see AI in healthcare, particularly for physicians, as an enhancement tool, something that will improve your efficiency and definitely ultimately what we want we're advocate of our patients, and we want to improve patient care at the end, right? But definitely there has to be when you need a pilot, right, of this movement. And we need physicians and entrepreneurs like you that are engaged with how we're going to learn to use this technology in the best efficient, but more important, safe way. And that's the part that we always need to reflect upon, right? So when we're talking about security, etc. So now I want to ask you about Mesh AI as a powerful scheduling tool. And one of the things that I always going back to the the component of privacy and the second component of accessibility. I have used multiple scheduling platforms. I'm a hospitalist by training, and I still do clinical work, and I have used different tools. And there has been a challenge in those two main areas, right? The level of privacy that you can get. But on the flip side, the level of accessibility you have either from your mobile devices, web-based, etc. So I wanna ask you about how you can approach that.
That's a really interesting question. And as a physician, as an entrepreneurial, innovative physicians, I want to say, first of all, thank you. Thank you for what you've done, especially since the pandemic. We know how hard your work has been. So now getting back to your question, these are very important questions. The way we have handled is that right now, as a clinician scheduling platform, we don't have to touch PHI. So no patient health information, no HIPAA level in Canada, HIPAA level type of information is ever shared on Mesh.ai. And we've managed to design the system, our tech stack, and the entire workflows and use cases that we support, that Mesh.ai does not need to connect to your EMR, doesn't need to talk to HR. So as a standalone system, we've designed a system that has three basic modules of requests, schedule generation, schedule management, knowing what people need, what physicians need, what providers need, and balancing it out with the needs of the organization, hospital, healthcare team, generating schedules at a click of a button so that you're not solving impossible puzzles as healthcare is becoming increasingly understaffed. And the third piece of that is that the schedules change. Life does not happen on schedule, especially in healthcare. How do you manage change? Last minute change in emergency. A month before a pediatric call shift has to be moved around. So the way we look at it is that we've designed a system that is entirely on the cloud and at the highest level of security that could easily pass SOC 2 compliance as well as HIPAA. And we managed to design a system that doesn't need anything beyond what it needs to generate fair, equitable schedules that are transparently. So our design has been extremely focused on the bare minimum in terms of information and time that we need to take away from physicians, healthcare teams to be able to give them very high quality schedules.
Fantastic. So now I want to circle back to entrepreneurship because you went through a very specific traumatic experience that led you to become passionate about how to tackle scheduling and improve efficiency. One of those that believes that physicians, particularly, and healthcare providers are in the best place to come up with healthcare innovation. They are at the front line. They're seeing the problem firsthand. But oftentimes there is a gap between healthcare innovation and the frontline providers. And one of the missions I have with my platform at Adoctorsjourney is try to narrow that gap. I want to ask you, how do you go from that idea of detecting a problem to feel like you're ready to develop this potential solution, and what tips you might have for someone out there that might have identified a different problem that might be thinking of come up with a solution for?
You probably touched on the number one source of failure for healthcare startups. Look at the sources of general startups failing. The numbers are very discouraging, right? If people look at numbers, this is no numbers game. You should not be an entrepreneur, not ready to work 80 hours for probability of success of 1 in 1,000. But having said that, one of the main causes is exactly what you mentioned, that technologists, passionate people who are passionate about various things, solving a problem, making money, that they get into this business without talking to healthcare providers, or maybe talking enough, maybe talking correctly, asking the right questions. So I can tell you my own experience. I knew enough that I didn't know enough. And so what I did was that I reached out to physicians in my network. After that incident, for about a year, I was on a medical leave from my academic job in Canada. And that gave me plenty of time to sit down, reflect on my own life. That changed me as a person. You have to have a near-death experience to get there for some people. And the second piece of that was talking to physicians. I learned two things. One, you need to be patient. Healthcare is not a place that is going to innovate quickly and for the right reasons. For a lot of people, they complain about it. But if you think about it, it's human life people in healthcare play with. There's nothing more valuable. So if people in healthcare are careful about technology adoption, things like that, they have every right to do. This is important. The second piece of that I learned was that you really need to talk to users more than any other. This is the number one lesson of entrepreneurship. Talk to your buyers and users before you build, and get rid of your hypotheses, right? As many uncertainty and entropy pieces that you want to get rid of. And for healthcare, this is extremely important, that you have many conversations with your users, in our case, physicians, fellows, and residents. And we decided that this is so deep because we're touching on healthcare staff, burnout, wellness, and things like that, that we actually need to have them on the team. We build the product right off the bat with physicians, fellows, and residents on the team. And I think that was instrumental for us to stay focused on what matters to them. That's why today we advertise as the first clinician scheduler. It's a tongue-in-cheek that actually a chief of staff of a hospital shared with us about 6 years ago. We loved it. It is really a platform designed to make life better for clinicians, built by clinicians. So I think that's really the big piece. Make sure you talk to people in healthcare and ideally build it with physicians. So the physicians that you're talking about on the front line, great additions to every healthcare team, from device all the way to tech or IT, being built as a collaboration between technologists and clinicians.
Fantastic. A lot of wisdom on what you just said. And it's been well documented that any new digital health company that involves physicians early on, at least in healthcare, they have more chances of being successful in the future. So now I want to piggyback on Mesh AI. Kind of also touch base on the struggle. Entrepreneurship is not easy. It's hard, right? And there's a lot of challenge and obstacles. So what do you will say has been the biggest challenge as you will develop in your company?
So we are probably an anomaly. My answer might not be applicable to a lot of people, but if you are a faculty academic professor, you might want to listen up, because that's the case with me. I've maintained my academic job, so I haven't been a typical entrepreneur that does 80 hours of work on the company. I have maintained my academic job, and this has been a passion project for most of the past 10 years that I ran alongside my academic life. In that context, I think one of our most important assets, if I can say that, was not raising money. That sounds counterproductive. When you raise money, at least to me, raising money is a responsibility that comes with a ton of covenants and responsibilities. And you need to make sure that you're putting the time, energy, and attention on the shareholders' money. And the fact that we did not raise money allowed us to stay focused on the task, which is making life better for physicians, not run after the money. We have had cases where people came and said, if you look at this particular scheduling problem in healthcare, it sells a lot better to the C-suite. We stayed focused on our task because we wanted to improve wellness and balance and reduce work-life conflict. And even if patient scheduling make more money, we were not interested. So we managed to do that. The second piece of that is that typically when you raise money, you're always thinking about the next milestone, the next round. You're under pressure. We were not under pressure. We were patient with our customers. We were patient with our teams, with our technology, focusing on the long-term goal. We want this to be the OS of a scheduling of healthcare. 10 years down the road, when people say scheduling of healthcare, the first thing that comes to mind is mesh, like Tesla comes to mind when you think about electrical vehicles. We've managed that by being patient. And this is, I think, a valuable thing if you have that luxury. And we've had it because of the parameters of our setting. So I think that's the biggest piece that I could share, and that might not be available to everyone.
Fantastic, but that's the perfect segue for I was going to ask you, where do you see the future of Mesh AI? You give me a little bit of hint of it, but in general, where do you see your company going in the future?
Yeah, we're still very small, right? Compared to massive giants in healthcare, such as Epic and other technologies that we know. We're small. And that the size allows us to be agile and responsive. We always take pride in writing code and testing and being in production in about a month, something that Epic cannot even imagine today in the giant size that they are. So the future we see for us is really a focus on technologies, again, enable a reduction of work-life conflict for people in healthcare in the front lines. And now physicians and residents and fellows is something that we have designed from the beginning, but increasingly now we're doing other professionals, nurses and technologists and things of that nature. And now we're doing public health units. The large fraction of public health units in Ontario, Canada are on Mesh AI. And we're so increasingly building the platform to make it the platform that it is now for physician scheduling to be as good in other scenarios, such as nurses scheduling, which is a fundamentally different beast. Sounds very similar, very different when you look at the details of it. So we really want to be the future healthcare scheduling OS operating system.
Fantastic. And how people can reach out to you and your company if they want to know more about Mesh AI?
Excellent. Unfortunately, when we started the name Mesh AI, we were the first. In the past 10 years, we've had 2-3 other copycats of our name, and that has caused a lot of issues for us. So I have to be very specific. The best way to get us is by not Googling Mesh AI, is meshay.io. Entering exactly that into your URL or into your search engine or asking ChatGPT, Mesh AI staff scheduler or clinician scheduler. That will take you to meshay.io, where you can learn about the product, book a demo. The only saddest story we have today that I'm trying to resolve right now is that we are actually turning customers around. We're booking new customers into the middle of next year now because we're full capacity. It's a good problem, a lot of people tell me, but for me, it's a big problem because if you remember, our mission is to make life better for physicians. Today, we did a big demo for a large healthcare system in the US. And at the end, when they asked us about timing, and we told them it's going to be next year, things turned very sad. So we told them we're going to do our best to accommodate at the fastest possible rate, but right now we're booking into the middle of 2025. And that's the way they can reach out, but we're going to do our best, especially your audience. If they reach out, we'll make sure that we'll get back to them, qualify their use cases, and if they are qualified, support them as fast as we can.
Fantastic. I'm so grateful to have you, Professor Sean Yousefi. Any last message for any physician and entrepreneur that is interesting to get into digital health care space and healthcare innovation?
I know physicians are very busy, very, very busy. And one of the things that has been a driver for me, the saddest story of physician, I get emotional about this, suicide rates among physicians, residents. I've had close encounter, not a close friend, but acquaintances of mine that have committed suicide in healthcare. I would say when you see a problem, you see a challenge, you see a bottleneck, we know how busy you are. Reach out to networks out there, such as your community, such as Innovator MD. There are communities online where with minimal amount of time and energy from a physician, a real problem can be tackled by technologists and engineers and other passionate people and make things happen. So do not accept status quo. And thank you for what you do. That's my message to physicians.
Thank you so much. And thank you, everybody, for watching and hearing another episode of Adoctorsjourney Podcast, navigating life and medicine with coaching and healthcare innovation. Until next time.